With an overwhelming majority of the public either COVID-19 vaccinated, contracting the virus, or both, chances are you have some level of antibodies. Antibodies are proteins that the body produces in response to an infection or vaccine. Current over-the-counter antibody tests fall short as they do not identify the COVID-neutralizing antibodies that are essential to know your level of protection. Our clinic has partnered with a high-complexity molecular laboratory to offer a SARS-CoV-2 Quantitative Neutralizing Antibody Test, or QNAT. Many different antibodies are elicited from a SARS-CoV-2 immune response or vaccination, but only a subset handcuff the virus so it can't take control of the cells and spread. This simple test detects the key immune response antibodies that shield the cells from the virus, preventing infection propagation. Neutralizing antibodies are like the special forces of the immune response, disarming the virus at just the right point before it can attack our cells. The immune system does not know how to best attack SARS-CoV-2, so it generates different types of antibodies in an attempt to stop the infection. Similar to throwing darts at a dartboard, many antibodies don't hit the bullseye. Using just a few drops of your blood, the QNAT measures the bullseye antibodies that stop the virus from binding to cells and propagating infection. Last year, the CDC reported that people with less than 30% COVID-specific neutralizing antibodies do not have specific COVID-19 protection and are at a higher risk of hospitalization and severe symptoms. QNAT is the only test that clearly explains the percentage of COVID-neutralizing antibodies and the level of protection. While a high QNAT score does not guarantee you will not get COVID, it is an important tool that will help you understand and manage the relative risk of getting severe COVID symptoms if exposed. QNAT might be right for you if you have previously tested positive for COVID-19 infection and want to know if you still have detectable antibodies, have never been diagnosed with COVID-19 but want to know if you've been exposed to the virus, or if you want to track your antibody levels over time. This test may not be right for you if you are feeling sick or have had a fever within the last 24 hours. If you want to understand if you currently have COVID-19, if you've been diagnosed with COVID-19 less than 10 days ago, if you were directly exposed to the virus in the last 14 days, or if you have a condition that weakens your immune system. Speak with your healthcare provider to see if QNAT might be right for you.